I'm Jayasundera. I'm an assistant professor of ophthalmology at the Kellogg Eye Center. I have a practice in retinal dystrophies and retinal surgery at the University of Michigan. So last year we heard that the Argus was approved by FDA, and since I see patients with retinal dystrophies, it was important for us to be a site that would offer this treatment in Michigan. So we approached Second Sight at the time, and we were chosen as one of the sites of excellence. And since then, we've implanted four patients with this device. I'm very pleased with how things have gone. Going into the surgery, not having done it before, you're always worried what complications patients might have from the surgery. And with each of the patients, when I first met them, I told them of all the downsides to surgery. But thankfully, we haven't had any. And that's been very reassuring for me. We have had little tweaks that we've had to do in a couple of patients, but I would just call them minor tweaks at this point in time. The patients have all been happy with the outcomes, and ultimately they're the best judges of how the procedure has helped them. Some of them find it more useful than others, but all of them have had some visual perception after these devices have been implanted. I think it's a really good technology for these patients because right now there isn't anything to offer them. And it is very basic visual perception that patients get from this. But for someone who has no vision, I think it means the world that they get something from it. The other thing I find very useful is actually when it comes to seeing children with this problem, people who are not eligible for this, but saying to them that we're actually doing the surgery in our institution and there is something that's being done for patients with retinitis pigmentosa. It gives them hope. And for someone who's been newly diagnosed, to know that there are treatment options that they may be able to have later in life is great. You know, the meaningfulness of the surgery really depends on the patient and what they want to achieve by having a procedure like this done. We know that this device is not going to get them the vision they had before. They're not going to be able to drive. They're not going to be able to read. But if it's basic visual perception that they're interested in and that would enhance their quality of life, excite them a little bit more than what they have now, then it is a great procedure. So it's really hard to say what is the standard of care for a patient who has profound vision loss and have retinitis pigmentosa. The surgery is elective. And typically when we say standard of care, it's when there is a situation which needs a certain procedure done, otherwise you would lose out. You would lose vision, lose the eye, etc. So in this case of elective surgery, it is really tough to call anything standard of care. But I think it is a great option for patients wanting some visual perception when they have no vision. I do think this procedure should be covered for patients who are wanting it done if they think that they can improve their lives by having it done. These are patients who've paid taxes all their lives and have contributed to our community and society, and they deserve to have something done to help them with their lives. The device is activated a week after it's implanted, and the patients are given glasses with the camera on it, typically a month after the operation. And then they go through this rigorous visual rehabilitation process. And they learn how to use the device, and over time they figure out what visual perception is, because it's a new type of visual perception. So retinitis pigmentosa is an inherited retinal disease, and it's the label of the diagnosis of retinitis pigmentosa is a rather old one. People who have pigment deposits in their retina, have vision loss and progressive constriction of visual field is as diagnosed as having retinitis pigmentosa. In this day and age, people are given genetic diagnoses for what they have, and that's what we strive to do at the Kellogg Eye Center at University of Michigan. Essentially, patients who have inherited retinal diseases have outer retinal degeneration. So that means that the outer retina, the photoreceptors, are lost, but they have relative preservation of their inner retina. And so for these patients where there is a presence of the nerve fibers on the retina, retinal prosthesis like the Argus can work. There are other treatment strategies that are used for different diseases, such as gene therapy, and we know that different retinal dystrophies are treated with gene therapy, but no one who has profound vision loss as this are eligible for gene therapy. So for this group of patients who have no light perception vision, there is no other treatment option other than a retinal prosthesis. So Argus 2 is an epiretinal prosthesis, and by that, the array of electrodes stimulates the nerve fibers by sitting on top of the retina. And the nerve fibers carry the impulses through the optic nerve, which has to be functioning, to the brain. For patients who have retinitis pigmentosa and who have vision of bare light perception or worse, NLP vision, no light perception vision, and those have been really set by the FDA as the requirements for having the surgery. What's involved in the surgery is typically a 4-hour operation under general anesthesia, and the surgery uses techniques that are classical to retinal surgery, which involves scleral buckling and performing vitrectomy surgery. One new step that we all have to learn as retinal surgeons is the tacking the array onto the retina. So I have been primary surgeon in the first two surgeries in Michigan, and I have assisted in the next 2 surgeries that were done by Dr. David Zaks. We have a number of patients in Michigan who have retinitis pigmentosa, and we have another scheduled for next month to be performed. Well, we've found Second Sight to be very helpful. We have an amazing team at the Kellogg Eye Center who do all aspects of this surgery and preoperative counseling and postoperative care, and all of our clinicians and scientists and occupational therapists, etc., have interacted with the company and have found them very easy to interact with, get in touch with, very helpful in terms of learning what to do. Yes, I would consider Argus surgery to be groundbreaking technology, since for so long we have told patients with retinitis pigmentosa that we will have a treatment and have never had a treatment until now. And it's taken a long time for it to come, and a lot of research and development. But now they do have a treatment, which is great for the patients. So I would like to see this technology approved for use in this disease and for people around this country and around the world to have access to it. And if we can improve the visual perception that you get from this, that would be amazing for these patients. I would tell them that this is elective surgery, so it's something that they must want to do, not that they have to do it. It requires general anesthesia for 4 hours, so they have to be fit for it. There are risks with retinal surgery. As with any retinal surgery, you can have retinal detachments, retinal tears, infections, bleeding in the eye. But in Michigan, we've had no significant complications that have not been addressed. So we've had very good outcomes in terms of the surgery. The type of vision that you would expect to have is very basic visual perception, that you're essentially able to make out differences in contrast, be able to pick out an object when it's in a very high contrast setting. And it's up to them to learn how to use the device as well. If there's a message I can give to the people who have developed this technology and everyone who's working on it right now, I would say that you guys have done an amazing job to have brought it to the patients in this country and around the world.